So in today's class, we will continue with the PALS. So we have completed all the algorithms related to pediatric cardiac arrest, pediatric bradycardia, tachycardia, and all those things. Now what we deal is how will you approach a sick child? So that is the next important thing. As I told, in a child to have a cardiac arrest, it is going to be very chances are very less, but they will have a lot of other medical issues where they will present to you, and you need to recognize that okay, this is a sick child, I need to act fast, otherwise that child is going to go into cardiac arrest. So you should understand how will you approach a sick child. So that is the most important priority that we are going to discuss today. So among this, what you have to remember is that most important thing, there is, as soon as the child comes into you, without you starting examining the child, by looking at the child you can make an initial impression. So the first thing that you should have, when a child, for example, the child is coming to your ER, the mother will be carrying the child, so the child will be in the mother's hand. So with that itself you can have an initial impression. So by giving an initial impression, we know that what is the major issue to the child, whether it is a sick child, whether it's a stable child, and all those things we will come to have an initial impression by looking at the initial impression at the child itself. So that is called as pediatric assessment triangle, or otherwise called PAT, pediatric assessment triangle. So this is that pediatric assessment triangle what you are seeing here. So there are certain questions that you need to answer. So with these things we will come to know that whether the child is sick or whether the child is stable. So this is called as pediatric assessment triangle. So it has got, as it's a triangle, it has got three components. So one thing, you have to have the appearance of the child. The second thing is the color of the child and work of breathing. So you can remember A for appearance, B for breathing pattern, and C for circulation to the skin. By looking at these things, you will come to know that whether the child is stable or whether the child is abnormal. So that is a one quick evaluation that you can do. That is called as the pediatric assessment triangle. So what are the components? Let's see what are the components that you need to assess. So let's come to the first one, that is the appearance of the child. So appearance of the child, the first thing, important thing that you have to look is for tone of the child. What is the tone of the child? Is the child able to walk? The child limping? Or the child is floppy? The mother is carrying the child is lying down like this. So what is the tone of the child? What should be the normal? The child should be moving his limbs. So that should be the normal tone. Suppose you are seeing that the child is not at all moving, the mother is carrying the child. Suppose the child is walking to you. Instead of that, the child is being carried by the mother. So that you think that there is some problem in the tone. There may be some paralysis, or the child is floppy otherwise. So you have to understand what is the tone of the child. In the appearance, the first thing that you have to look is the tone of the muscle tone. That is what we are telling, muscle tone of the child. So that is the first thing that you need to remember. The second thing is that interactiveness or irritability. The child is irritable. Child is irritable. How will you know the child is irritable? The child, when you are going and trying to touch the child is becoming very irritable. The child is crying throughout the time. So that is thing is that the child is irritable and interacting, whether the child is having some eye contact with you. So all those things you will come. If there is no, the child is irritable and there is less interaction, you can think that there is some issues there. So that is the next thing that you need to look for. So tone, irritability, and C is consolability. So whether child is continuously crying, the mother is able to console the child. Okay, the child is stopping the crying, all those things you have to do. So consolability is the next thing that you need to look in for, whether the child is consolable or not. So that is the next thing. So in appearance, the first thing what you have to look for is the tone of the child, interactiveness and irritability of the child, and consolability. The next thing that you have to look in for is, so you can remember a mnemonic TICLS. So we have completed tone, irritability, and consolability. L stands for looking. Whether the child is what is the look? Whether the child is looking at one area. Maybe the child is having a seizure. So the child is only looking at one area. The gaze is fixed to one area. The child is statically looking only at one area. One side the child is neglecting. So the look of the child will be like this. So what is the look of the child? So the next thing that you need looking for appearance. So look, or what you can call is gaze. Okay, and S stands for speech. Whether the child is speaking anything or whether the child is having some abnormal noise. Suppose you know that the child cry will be a certain pitch sound. Instead of that, the cry itself, the tone has changed. Why the tone has changed? When the child is going to develop a vocal cord edema, the vocal cord will start getting edematous. So that vocal cord edema will get the pitch of the sound will change. So what is the whether the child is able to speak? The child is unable to speak. That is a problem. The child was speaking. Now suddenly the child is not speaking means you have to suspect a foreign body aspiration. So all those things you need to consider. So appearance of the child, what all things you have to look in for is the one thing. The first thing that you need to remember is the tone of the child. Next thing is the I is for the irritability and interactiveness of the child, and C is the consolability of the child, and B abnormal look. Any what is the look the child is having, and speech, abnormal speech or cry. You can remember the mnemonic tickles, TICLS, where T stands for tone, irritability, whether the child is able to console, look, and speech. So these are the things that you can remember. So when you, without examining, you have not started examining the child at all. Okay, you have not starting touching the patient. The whole thing should be over by 10 seconds. The whole your initial impression should be finished by 10 seconds. So without touching the child, we are coming to see what is the appearance of the child. The appearance of the child, it's the child is floppy, drowsy, lying on his mother's limb. So the tone is low tone and irritable. The child is drowsy. What is the consolability? The child is not at all crying and there is no look, then there is no speech. So we are going to deal a sick child there. Suppose the child is very playful, actively moving around in mother's lap. So that means the child is stable enough. You can have some more time. So that is why by the appearance of the child itself, we will come to know whether the child is a sick child or whether it's a stable child. So that is the most important thing that you need to look in for. That is the first part of your pediatric assessment triangle. So the next thing that will come is the breathing pattern. So breathing pattern, what are things you need to look in for the breathing pattern? So work of breathing, the most important thing is the respiratory rate. Whether the child is quite tachypneic, the child is quite tachypneic, breathing faster. So that is one thing that you need to remember. And you are able to hear some abnormal sounds like stridor. Abnormal sounds like stridor, wheeze. So that is the next important thing. So next important thing is that you have to see whether the accessory muscles, whether the normal muscles for respirations are the intercostal muscles and the diaphragm, whether the accessory muscles like the sternocleidomastoid, the child is breathing like this, the sternocleidomastoid becomes very active. So whether you have to see the child is having active enough of the accessory muscles of respiration. So you have to look for accessory muscles of respiration, whether it is active accessory muscle, and there can be intercostal retractions. When you see a sick child or when the child is having pneumonia, what will happen? The intercostal, between the intercostal space, the muscle will be retracting inside. So that is called as intercostal retraction, which is again one of the important thing that you need to look in for when the child is having some breathing problems. So retractions, and another thing is nasal flaring. When the child is breathing through the nose will get enlarged and it will become red. So that is called as nasal flaring. So whether you are able to see a nasal flaring, and next most important, if the child is apneic, child is not at all breathing or is only having jaw breathing, that is jaw breathing. So otherwise we can call it as gasping breath. So these are the things that you need to look in for. So from work of breathing, we have to look for any, first most importantly, respiratory rate. Any accessory muscles are very prominent. What is the respiratory rate? By just looking at the child, I am not asking you to count for, we are total 10-second assessment. By looking at the child, somebody is breathing, you right away know that the child is tachypneic. I'm not asking you to count the respiratory rate here. I'm just asking you to see the chest, see the child, how the child is breathing, whether there is any abnormal sounds like stridor. When the child has come, the mother is giving you history. The child was playing around. The child is a 2-year-old child, and suddenly the child is not crying, but only have some abnormal sounds the child is producing, and the child have become cyanosed. What will you suspect during that time? Foreign body aspiration. So that's the most common thing. The child was moving around, the child would have taken something and the child would have swallowed, and because of that the child would have gone into uh, for a foreign body aspiration. So that is the important thing that you need to remember. So The next thing that you need to have is the work of breathing. So what happened? Okay. So that is your respiratory rate, abnormal sounds, stridor, any wheeze, accessory muscle and intercostal retraction, and finally the child is apneic or gasping for breath. Now coming to the most important thing, the next thing is circulation. So there are three things that you need to look in for circulation, whether the child is having any pallor because the color of the skin. But in our Indian skin tones, it might be difficult because if they are the texture, the color of the skin, if that it is dark, it is difficult for us to say whether there is pallor and mottling and cyanosis. Is difficult for us, but for Western people, very easy to say whether there is a pallor. Pallor means there is decreased blood supply, perfusion is low. Mottling means again due to poor perfusion, the skin have started mottling. Mottling is less like, how will I say? I can show you a picture how a mottling will look like. We will just see here. Skin mottling. My spelling is too good. That's why creating skin is fine. No space MOTT skin mottling. Okay. Images. See the images here. See the images here. See, it is very easy for a dark skin people to see. The image you will be able to see a skin mottling. It is very easy, but difficult to see the clarity here. What you are able to see. This is how a skin mottling will look like. So we have to look for any evidence of skin mottling. So that is the most important thing. Skin mottling is there or not, and there is cyanosis. So from these things, by doing with the 10-second. So what is called as pediatric assessment triangle, we are having an initial impression of the child. With this initial impression, we are coming to a conclusion that whether the child is a very sick child or a stable child, and it is also giving us a clue whether this child is having a respiratory issue or whether the child is having a circulatory issue. Understood? If the child is having any problem in these things, so we are going to deal with the patient with a respiratory issue. Suppose there is a problem with the circulation, we are going to deal with the child with circulatory problems, some hypotension, dehydration, what we don't know. So after you do your initial assessment, we are coming to have a conclusion that whether you are going to see a stable child, whether you are going to deal with a sick child, or whether you are going to deal with a child who is having a circulatory issue or respiratory issue, or it can be a combination of both. Suppose the pneumonia was there and the child has gone into a septic shock, so there will be a respiratory issue as well as shock. So that is the idea that you will get by doing a pediatric assessment triangle. So the pediatric assessment triangle comprises of 3 steps. You have to have an initial impression. As soon as the child comes into your ER, you need to, without examining the child, by just looking at the child, appearance of the child. So what are the things that you have to look for in the appearance? First thing, tone of the child. What is the muscle tone of the child? The second thing, what you have to see, whether the child is irritable or the child is interacting. Whether child is crying, if the child is crying, if the child is consolable. So that is the next thing that you need to do. Then the next thing, what is the look of the child? The child is looking only at one side, can be a seizure. So you have to look at the look of the child. Then the final is the speech of the child. If the child is able to speak, abnormal sounds, the child is anything producing, the sound tone has the pitch of the sound have changed, or even the child is not able to speak. Then coming to the next thing, breathing. Breathing, the most important thing, quickly see whether the tachypneic or not. I'm not saying you to count the respiratory rate, to just see whether the child is tachypneic or not. Followed by what? You have to look for the accessory muscles. The accessory muscles are prominent or not. Chest interactions, intercostal retractions are there or not. The next most important thing, what you have to look in for, any abnormal sounds, stridor, wheeze, all those things the child is able to produce. And next important thing we have to see for is the nasal flaring. The nasal flaring is there or not, or apnea or gasping breath. So these are the things that you need to look for when the child is having an in assessment of work of breathing. Then coming to circulation, 3 things you have to say. Color of the child, which is the most important thing. What is the normal, whether it is a normal color of the child. If it's okay. If it is not normal, what all 3 possibilities you can have. you can have a pallor, you can have a mottling of the skin, and you can have cyanosis. So from these things, you will make an initial impression to the child. Okay, I am going to deal with a stable child or a sick child. Stable child, sick child. If it's a stable child, primary, it can be a respiratory issue or it can be circulatory, we don't know. And sick child, again, it can be a respiratory or a circulatory or a combination of both those things. So from this initial impression, we need to go to the next step, that is your primary assessment. You start examining the patient now. We have not touched the patient till now. Now you are going to examine the patient. So what we are dealing here is an approach to a sick child. So approach to a sick child, you can have two pathways. You can have understood that the child has become unresponsive. You have examined the child is having pulse and breathing well. So if the child is not breathing, or you have to go for the BLS algorithm. If otherwise the child is stable, if the child is not in cardiac arrest, you have to come to this algorithm. You have to go for the initial impression, PAT assessment, pediatric assessment triangle assessment, appearance of the child, work of breathing, and color of the child. These are the things that you need to look in for. And after that, what you have to do? You have to come to a conclusion. What is your initial impression? And after that, you need to go for your primary assessment, which will start with airway, breathing, circulation. That we'll do it in the next class. Okay. This is an exam question, very important exam question. This can be a 7 mark or a 10 mark question to you. Pediatric assessment triangle. So, PAT triangle, you have to know in and out. Okay. Thank you.